highlight lectures, it's my real privilege to introduce Dr. ROS Ahamd from Leicester University Hospital to speak to us on diversity leadership in interventional radiology. The platform is YiiRS.
Hello, good afternoon, everyone, and thank you for inviting me, Zee, to present this lecture on diversity leadership in interventional radiology. So my background is I'm an interventional radiologist at Leicester and the head of service of imaging there, and I'm also the outgoing chair of the Women and Diversity Committee at BSIR. So I'm just going to discuss what themes we're going to look at in this presentation. I'm going to describe why we need to discuss diversity leadership in interventional radiology and more broadly in healthcare, and also to make it relevant to you as future interventional radiologists, how you can improve your leadership skills and how this will improve the situation and the benefits it will bring to you, the organisation, your patients and the local population. So this is a quote from Brené Brown, and she's written quite a few books on leadership in large organisations. And she says that people are opting out of vital conversations about diversity and inclusivity because it's a difficult subject and people fear being wrong, looking wrong, or saying something wrong. So that kind of chimes with me. But essentially, a workplace that is diverse is something that provides what you need to show up and do the work, what will get in the way of you showing up to do that work, and what support looks like, which can be different for different people. So the qualities in interventional radiology, I mean, I would argue that talented doctors have naturally got leadership qualities. The positives are that we manage a team, time, resources, operational stuff and equipment aspects all the time and do complex and multiple tasks and decision-making, critical decision-making. These are all qualities that lend themselves to leadership. We're trained in service and quality improvement as part of ARCPs and continuing professional development. And we use these skills on a daily basis in our interactions in the team. And this can be extrapolated to a department or a large organisation. The negatives are with a medically qualified leadership is that we have a scientific outlook. That's how we've been trained. And this may retract from the human factors, which are an important and also the main factor in team working and leadership. And we're uncomfortable and untrained at addressing culture factors. These are the HR issues. And sometimes doctors are too expert to see the big picture or take suggestions from other professions. So things to bear in mind. So there's some positive qualities, but also some negatives that we need to work at. Doesn't mean we can't learn these things. So why do we need this diversity talk? So back in 2015, the Workforce Race Equality Survey was created. And this was due as a result of some difficulties at Mid Staffordshire Hospital. And there was a report written. And that Simon Stevens, who was the chief exec of NHS England at that time, said care is far more likely to meet the needs of all the patients we're here to serve when NHS leadership is drawn from diverse communities. Now, there have been some data gathering measures because it's sort of a soft area as to assess diversity at all levels in the NHS. But we have the Workforce Race Equality Survey, we have the GMC staff and trainee surveys, We have the Royal College of Physician appointment to consultant posts and the number of GMC referrals of BAME doctors. All this data supports that there is a lack of diversity and it's impacting on the care that we deliver to our patients. So factors within the sphere of interventional radiology, there's a gender gap in secondary care, which is exhibiting itself in interventional radiology. We're having difficulty recruiting, and that's because we're not got enough women entering the speciality. There's a gender pay gap. Women have children. They often have children at the most important time of their career progression. They apply for less clinical excellence awards. They gain less clinical excellence awards. They're not receiving those promotions. There's also very few BAME staff in very senior management roles. The figures have changed a bit, but they're still very low. The Royal College of Physicians showed a big difference in likelihood of being offered a consultant post for the first time for BAME respondents. So this was the Royal College of Physicians examined 8 years of data. So there is a need to discuss this, and it's also impacting on the health of our patients and our population. We've seen that with COVID. Mental health, very poorly taken up by Black patients, cardiovascular disease, perinatal mortality, life expectancy, child poverty. All these things are really important and impacted by diversity. So within intervention, what we're seeing is not enough numbers coming into intervention, and certainly not enough women. The makeup is about 10% of interventional radiology consultants are female. And there's a difficulty retaining staff and attracting them. We need to make job plans more flexible, have more less than full-time working, and make that an easy transition that blends into the team. And the lack of support, if it doesn't look specifically at diverse needs, will impact on performance. Also, communication is affected by those relationships. And if you're not used to different people, this can be difficult to give or receive constructive criticism, provide credibility and strengthen those relationships. And, in the worst case scenario, this is demonstrated as increased referrals for BAME doctors. But please note, this is not related to interventional radiology. This is just from the GMC surveys of the whole of the NHS. And there's a slower response to the needs of the patients and local population. And a lot of that will relate to communication and difficulties related to that. So one thing I've learned on my sort of lived experience in leadership is that overperformance doesn't necessarily empower you as a leader. In fact, this is what factors would be taken in to a promotion, empowering yourself in the organisation. For example, if you're applying for a consultant post or a fellowship, and this data is from the NHS Leadership Academy, which I was involved in, went on one of their courses. But actually, it shows you that 10% relates to your performance, which is your day-to-day work that you're tasked with and the quality of the results you deliver. And I think this causes a lot of problem when people get turned down at interviews because they're like, well, I'm working over and above. My work is of a high quality. Why wasn't it me? But actually, if you look at this, this is what is going to get you that job, get you that promotion, get you that leadership. It's exposure. Do people know what you're doing? Does your boss know what you do? Do you know other people in and outside of the organisation? Have you made the effort to see the interview panel and discuss things with them? And interestingly, 30% is your image, which actually you can easily have a personal brand. And that's really about how you're perceived. If you were on the other side of the table, what would you think of yourself if you were discussing something? If you were a leader, how would you be perceived? Do you maintain a positive attitude? Do you lead with solutions to issues, or are you a roadblocker and quite pessimistic about change or alternatives? So my key note is, yes, you're not going to get anywhere if you don't work hard. That's take and be good at your job. But there are these other factors, such as your image and exposure. So what I would like to reiterate that your performance has to be excellent, but these other factors are important as well. So just to say again, a lot of doctors fall into the trap of trying to be perfectionists, and it's very easy to overperform, get burnout, and not have the resilience to succeed. So we are human beings, so we have thoughts, feelings, and behaviours. So this is sort of a psychological triad. So there's no point suppressing those feelings. You have to reflect and think before you act. And just to say that, everyone has a unique identity and has components of being a dreamer, a realist, and a critic. And we need all those things. And we also need people that are different from us in order to get something that's operational. But your identity does not need to be concealed. You don't need to be a square peg in a round hole. You can make that leadership your own. And your personal brand your own, and embrace it. So looking at performance, image and exposure, what I would advise you as into developing your leadership and management skills is to build networks. We've got the Junior Interventional Radiology Committee at BSIR, but there's plenty of stuff that you can volunteer for, show curiosity and interest. It doesn't necessarily need to be related to interventional radiology. Sometimes just follow your interests, and that can develop. Think about how you're received and perceived, and how you would like to be perceived. And actually, if you start thinking and feeling that way, you'll start behaving in that way, and people will respond to that image of you. Know what's going on in the system and in your organisation. In the hospital or the healthcare setting that you work in. And this will help you increase your network exposure as well. So there are support and resources. I would say that all doctors need these skills in order to progress within interventional radiology, within a team or a department, regardless of if you want a management portfolio or not. So I would start with yourself, your individual behaviour, understand your thoughts and feelings and how they impact on you. Think about your personal brand, the image that you want to portray. It has to be something that's genuine. It has to be you. But everyone can be a role model, and how, as Z would say, creates that ripple. Have a caring and curious approach to difference. People might be different to you, but there is someone there, a human being who's unique and really interesting that you need to get to know. Be grounded. So this can affect BAME doctors or people that are different. You deserve and have earned your position, which is right here in medicine. So be you and have confidence in yourself. And in order to that, you need to feel validated. So surround yourself with positive people who energize and validate you. And you'll know who they are. They may be family or friends or local, but it's important to try and get those people at work as well. Remember that all advice is useful, but it's not gospel. Don't take to heart something that someone said who's known you for 20 minutes. You can take advice, but it needs to be in perspective, and you need accurate advice, particularly related to working as a woman in interventional radiology. You've got some great role models on this course. It's easily achievable, and you can be successful if you're determined. So you need to get good careers advice, which is accurate about that, about less than full-time working, about radiation doses, which you're satisfied with. One thing that I think is really important for you guys is to have role models, so that seeing is believing, and also mentorship if there's any opportunity. And actually, as part of your networking exercise, which I hope you all do, think about trying to network with a mentor. There might be a scheme through medical schools, universities, for junior doctors, but if you can get some mentorship that you feel you can trust and discuss things openly with, that's very useful. Also, don't neglect coaching. You need skills to be able to communicate effectively. So as you would, for example, prepare for an interview, for a post, think about coaching in all aspects of your work and career progression, and think about it as a negotiation rather than a grateful receiver, just being grateful for what you can find that's spoon-fed to you. Just think about kind of developing that journey yourself. And obviously, as I've said, the building of the networks. So promoting IR as a career choice. So the Women and Diversity Committee have been doing a lot of work related to this. So I think it relates to seeing people like you doing the procedures, having good mentorship, networking, and the BSIR gives you a good opportunity there to meet like-minded people as yourself, and also to increase your network so it's beyond your own department and you're getting to know other people and other specialities. I think one of my roles and as a woman in interventional radiology is to talent spot and to tell people and encourage them to join us. I also think that doing a fellowship or some kind of training outside of your base training program is a really useful exercise, not just because of the skills that you would learn at a centre of clinical excellence, but also because the people you will meet, and also because you will see that intervention can be performed in different ways with equally successful results. You know, just because something's been done one way doesn't mean that a department can't work in a completely different way and achieve excellence. So it brings that open-mindedness that actually, you know, there are different ways of doing things. So organisational shifts related to the data on diversity. There's the NHS People's Plan, which is about investing and caring for staff in order to empower them to lead, to deliver high quality care and quality improvement. So the NHS has now taken on compassionate leadership is the sort of way that studies and the evidence is showing that actually people, if they have a feeling that they belong and they are engaged with the organisation, this will show in the work that they do. There needs to be more accountability and scrutiny for decision making, particularly related to recruitment, possibly something the CQC will look into. And diverse leadership will attract more of everyone. I think it indicates a balanced department where different views and people are valued and respected. So just a little plug here that at University Hospitals of Leicester, we've got one diagnostic GI consultant post and 2 interventional radiology posts. So look out for that advert if you're approaching CCST and get in touch with me. Thank you. That's the end of my talk, but I'd like to hear any questions.
Ross is fantastic. I absolutely love the way that you deliver this. Helen's going to take over.
Thank you so much, Dr. Ahmed, for that, inspiring us as expected, really. I'm not sure if there are any questions from the stage, actually.
Okay.
I'm just checking.
Not yet. Ross, let me ask you a question. What would you advise the young generation now? What would they look out for developing themselves, their own brand, what would be your
I would say
for them?
Focus on your areas of interest and discuss those with your trainers, or if you're interested in interventional radiology, start talking to the interventional radiology leads at your organisation or other organisations. Start getting involved in any society work or audits within that, just to increase your exposure. So definitely, if you can get involved in a quality improvement project related to interventional radiology, that will make sure the people that need to know you do know you.
That's great. Thank you so much for that advice. Not sure if I can bring some.
I have something for Ross. I wanted to ask, because Ross clearly is a diverse leaders champion. In your career so far, what would you consider as your highlight? And then what would you consider as your lowest
difficult
thing?
So I suppose the highlights have been, being involved with the Women and Diversity Committee and BSIR, and also I'm my head of service role. I was very flattered to have been asked to do it, but I take great pride in the small changes I've made in my local department in terms of promoting diversity in women. So they're probably the highlights. I think the lowlights are the barriers that many women have faced, particularly women of colour. Not necessarily as a consultant, because I feel as a consultant you're in quite a powerful position, but I think lower down the pecking order, as a junior doctor, just through training, there are those little microaggressions which aren't so little. They can affect your drive and your kind of self-belief. But what I would advise people is that we're all determined folk, and to rise above it, and just to make sure you've got that grounding and that support squad behind you.
Thank you, Ross, for sharing that. That is a really touching lecture.
That's great. It's been a pleasure. Thank you very much.